I want to inspire you to think about something you could do, because it's something I meant to do, and I'm actually having a sabbatical year off my practice at the moment, so I'm not able to do it. But I put the challenge out there for you guys. When you think about ways to encourage your patients to increase screening, for example, we often think about the concept of champions, about people who are recognised by a patient population that you're trying to improve screening for, or recognised more widely in your practice, for example, as somebody who people look up to, whose wisdom or thoughts that they value. And of course, one of the people in your practice that they think that about is their GP, their practice nurse, other people who are relevant to them when they come to your practice. And so the thought that I had, and the challenge that I'm putting up for you guys to think about, is to do with bowel cancer screening. And the idea that I had in my practice is that, in fact, I should do the little video about how you do your bowel screen and put it up on our practice website so that we could direct people to it, and they would be seeing someone who's familiar to them doing the screening and realise that this is a really simple process. Now, I wasn't personally planning to bring Sam and the guys into my toilet and do it there, and that's part of the creativity that you guys could invoke in your own practices. I well remember those experiments when I was a medical student, where we had a sausage that was covered with Serratia fluorescens or something. Mary and I went through university together, and you can see that she obviously weathered a lot better than I did in that process, but that's all right. But we had to touch this sausage with toilet paper and then put our hands in an agar plate and then see where the stuff grew, to show us that if we'd actually washed our hands in between those two things, we then got much less stuff growing on this agar plate. So you don't have to sort of go the real deal, but you could think about the possibility of posting up a video that you could direct patients to and say, look, this is what I do. I'm going to show you how to do it in a mocked up sort of way and show you how easy it is to do this test. Because what people get is a little piece of paper. We've all got our bowel screening tests, and it's just a little sheet of card that sort of says, oh yes, there's the two little sticks, they're now in the new format. Make sure you realise that. Instead of the red and blue sort of containers, and this is what we're going to do. I think it would be quite fun to do that with a sausage, or I don't know. You could do the vegan version. I'm not sure, but I just put that challenge up there for you. Okay, so I had a couple of closing slides that I was going to use for you, and one of them, probably a really critical one. The first thing was about supporting your team, and I had another nice photo of one of our teams, in this case promoting about organ donation in our practice, because that's something else we've got a very strong philosophy about. But it is really critical. You need to create those teams that are going to work together to help you in your project, and you need to support that team. And that might be about having meetings where you put lunch on. It might be about going out somewhere, getting a quiet corner in the pub to discuss something that you're doing. But it's also about nourishing that team and supporting them and celebrating what you've achieved. So one of the things we are really, really poor at in primary care is actually about celebrating success. We're really poor at it, okay? I should challenge all of you to make sure that every individual practice that's represented here gets a photo of at least 2 or more members of your practice in the local paper about something you've achieved over this 12 months to do with this, because the patients absolutely love it. Your staff members grow 5 centimetres taller, okay, to see their picture in the local paper. It's incredibly powerful, okay, and it reinforces the message. Look at what we've achieved. We are creating stellar results in terms of improving our capture rates for bowel screening, breast screening, cervical screening. Really, really powerful, okay? So I can't emphasise that enough. That's sort of included in communicating things around the practice, putting up the chart, on the fridge, on the whiteboard outside the kitchen, whatever it is, that shows what our rates are doing, okay? Incredibly powerful, simple visual things, really, really powerful, okay? I'm getting old enough I do have to put my glasses on if I can't read it on the big screen. But in summary, what are you going to do? 1, you're going to increase cancer screening across your population with some specific target groups in mind. You're going to build a team supported by your practice to do this. Okay, all these slides will be available. Just see Anne, she'll be able to put them up for you. You're going to extend yourselves, because if you keep doing what you're doing, you're going to keep getting what you're getting. So you've got to do something different. There's nothing magic about this. This is Einstein's third law, the law of insanity. Okay, if you keep doing what you're currently doing, you're going to keep getting what you currently get. Okay, so you've got to do something that you don't currently do. Okay, you've got to learn to follow your hunches, and that's where sitting down in your practice is such an incredibly powerful thing. You don't have to have 68 staff. You might only have 4 staff. Okay, but workshop what it is you're wanting to achieve and what ways you might be able to make that happen. Okay, you need to measure your success. And that is critical, that measurement, measuring where you are now, identifying what you want to achieve and measuring how you're going in trying to achieve that is critical, and put it up there, okay? Put it up there for people to see. Celebrate success. I can't say that often enough. We are terribly, terribly poor at doing that in primary care, okay? It is really, really powerful to do that, okay? And learn from this experience. I said at the start, this is not a pilot. I will say it again, this is not a pilot. Things you learn from this process you can institute in all sorts of other ways, okay? You're focusing on 3 sorts of cancers, okay? That wouldn't have helped me if I was coming to your practice, all right? There are other cancers, there are plenty of other things that you can do better. We can all do better, okay? Find the data that shows how you're going, identify things that people are interested in, and use the process to build on that.